Well, welcome. Glad to have you. Now, colon cancer is a big deal in Kentucky and nationwide.
Yes, indeed. It is a big deal. It's the number 2 killer for cancer deaths, and it's highly preventable. 90% of these colon cancers can be prevented. So it's unfortunate that it's so prevalent, and yet with proper screening, many cases can be caught early and prevented.
And cured.
And cured.
Now, Dr. Rea, who's at risk for colon cancer?
Well, certainly most all Americans are at risk for colon cancer. There's no one that's not at risk for colon cancer. The incidence increases with age. So at age 50, with no family history of polyps or cancer, and someone with no symptoms, every American should be screened.
Now, is there any, other than age, does smoking or drinking make a difference, or family history?
Sure. So there's modifiable risk factors. So obesity, sedentary lifestyle, red meat, diets high in saturated fats are associated with increased risk of colon cancer, as well as high alcohol intake. But there are certain things that people can't control, and that's their family history. So a family history of cancer or polyps puts her at higher risk, and also genetic mutations that you're born with that may not be handed down from family members to family members that people can't control.
Well, Dr. Papp, what kind of symptoms that they might think, okay, this is more than just a little bug or gastroenteritis or irritable bowel? What's something that might think, okay, we need to pursue this a little further?
Well, the beauty of screening is you're catching people before they have symptoms, and that's actually the best time to catch it, because if you're starting to have significant bleeding or change in your bowel habits or abdominal pain, you're seeing blood streaking in the stool, even blood in the bowl or a change in shape of the stool, all those things can be a sign of colon cancer. But if you come in for screening before those are found or before those are noticed, you have a much better chance of finding a preventable lesion. And so we really emphasize you don't wait till you have a symptom. You go ahead and get screened on the basis of your age, starting at age 50, earlier if you have some of these risk factors that Dr. Rea was mentioning.
Okay, let's talk about screening. Tell me, Dr. Rea, there's obviously the colonoscopy. We're going to talk about that in a minute. Are there other ways to screen for colon cancer?
There are certainly other ways to screen for colon cancer. There are stool tests. There's a new, more specific test for blood in the stool. And there's a standard fecal occult blood test, card test that you could pursue. Those have to be done annually. So the patients have to be committed to doing that test every year. A year goes by very quickly.
Yes. That
accompanied with a short scope, a flexible sigmoidoscopy that just looks at the left side of the colon, is a reasonable approach. Now, the short scope only looks at one part of the colon, misses the rest. And the blood tests, even though they're very specific, they are really testing for advanced lesions, very large polyps or cancers, not catching those small polyps before they can give you more trouble. So colonoscopy remains a gold standard.
All right, obviously the gold standard. So Dr. Papp, tell me about the colonoscopy. Everybody talks about the prep.
Everybody's worried about the prep. There's a wide variety of preps available, and they can be from a smaller volume to a larger volume. The key is you need to get that colon washed out so the physician can get a good look inside. I personally have had 3 colonoscopies. I don't find the prep that bad. Some people have trouble with one type of prep. If that's the case, next time they can try a different. So you have many choices, and that's something you can discuss with your physician or the endoscopist before you have the procedure.
All right, tell me about the procedure. Tell me what happens.
Well, the procedure, you take the prep the day before, you're on clear liquids the day before. The next day you come in to the endoscopy center. You meet the physician, you meet the staff. They'll place an IV in for IV sedation. You're given sedation. The scope is passed. It usually takes, on average, 20 minutes or so to do the test. You need to hang around a little bit after to recover from the sedation. And then for the rest of that day, if you did receive sedation, and believe it or not, some people do it without sedation, but most people do it with sedation. And if you did receive sedation, the rest of that day, no driving, no signing important papers, no power tools. Just take the day off and relax. It's your day off. The next day you can get back to regular activity.
All right. Now, Dr. Rea, during the colonoscopy, if you find a polyp, you can most times just fix it.
Most of the time we can take it out right there, and that's the advantage of the colonoscopy rather than the stool test, or also there's CT scans that can be used for screening, but we can't do anything about the polyps or any other abnormalities with those tests. So that's the advantage of the colonoscopy, coming in, finding the polyps and getting them out all at one time.
Okay. Now, Dr. Papp, not all polyps are malignant, but some of them can turn in that way, and you can solve a bad problem.
Exactly. There's oftentimes when I'll go home in the afternoon or in the evening after doing several colonoscopies, and if we've removed a large polyp, I think to myself, this person may not know it, but he's going home to his family and has just avoided a terrible disaster with a colon cancer. He's had this polyp removed. If he hadn't come in for the screening, it may have developed into something much more serious, dealt with the colon cancer, the chemotherapy, all that goes along with it. Instead, he came in, he had the polyp snipped off. He doesn't know any different. He goes home, enjoys years of life that he wouldn't have had if he had let that thing grow and never gotten screened.
All right, we've got your location on the screen. You do that as an outpatient. It's a great place to do.